This segment of Delmarva Life is brought to you by Delmarva Dental Services.
All right, I've been there, you have been there, you're talking to somebody and desperately hoping that we don't have bad breath. It's just one of those things you don't want to be known for.
That's right. Well, it turns out bad breath can come from various sources in the body. That's according to Dr. Joseph Harmon of Delmarva Dental Services. He says, thankfully, there are ways of managing it. Delmarva Life's Katie Zerilli finds out more.
Bad breath. Like an ugly scar, it's not something anyone really wants. But if you got it, it can be hard to hide. It's an annoyance that we've always had to deal with.
2,000 years ago, the Jewish law, there was a, you could be divorced for having bad breath. You could divorce your wife for having bad breath. Yeah, and some of the Chinese emperors would make people chew oil of cloves before they came in to speak to the emperor.
Now, fortunately, those laws have relented. Bad breath, however, hasn't. According to Dr. Joseph Harmon of Delmarva Dental Services, there are several potential starting sources.
Of course, it comes from your mouth. It can come from your stomach. It can come from your nose, and it can come from your breath or your lungs.
When it comes to your mouth, Dr. Harmon says it has to do with bacteria and what you're eating.
There's bacteria that like oxygen, and there's bacteria that don't like oxygen. The bacteria that don't like oxygen make smelly sulfide gases. Okay, so if a person has gum disease and they have bacteria that are down underneath their gums, they're going to produce bacterial sulfides, which are going to give a bad odor. And also, if you have cavities, which is oxygen-liking bacteria, but still they're producing gases as well.
And keep in mind, any bacteria in your mouth can also get in your tonsils. He says the tongue can be troublesome too.
You have to think of tongue as like a wheat field. Some people have tall wheat and some people have short wheat. Okay, if you have tall wheat, more stuff gets in it.
Dr. Harmon says there are ways, of course, to combat these culprits.
So you can brush your teeth, of course, you can floss, and you also can rinse, and there's other things you can use too, oral probiotics and things like that.
Next, the nose.
If your nose you have postnasal drip, once again, bacteria that don't like oxygen, that's why they're way up in there in the back hiding. They're going to drip down your throat. They're going to have gases to give off. And so if you have sinus issues, you're going to have bad breath.
He suggests a sinus rinse to take care of that bad bacteria. When it comes to your stomach, it of course has to do with what you're eating.
If it's digesting something that's smelly, like garlic and onions and things that are hard to digest, like meats, and if it's spicy, it's going to come from your stomach. So you'll have odors coming from your stomach.
And from the stomach, it gets into the lungs.
It goes into your stomach, goes in your bloodstream, comes out when you exhale, and then you have smelly breath.
He says when it comes to cover-ups, a lot of them are temporary.
There's very few long-acting breath mints, long-acting mouth rinses.
He says when it comes to mouth rinses, typically the better it tastes, the less effective it is. And brushing your teeth isn't about the particular toothpaste, but the scrubbing of biofilm off your pearly whites.
Biofilms are very hard to remove, and they're best removed by old-fashioned scrubbing. Even stones in the water, in the stream or a waterfall get slimy. That's a biofilm. Same with your teeth. All that is a slime layer on your teeth. So the brush is the thing that works.
Dr. Harmon says there are new oral probiotics that are powerful.
Basically, it's a genetically modified bacteria. It's going to freshen your breath because it's oxygen. It's going to lessen the bad guys you have. And it does that in 15 days, but you have to take it before you go to bed every night. And if you stop, 15 days later, the bad guys come back. So, and they have one for kids, adults, and they even have one for dogs. Now, dogs don't get cavities, but dogs get gum disease.
Dr. Harmon recognizes it's not a fun issue to deal with, but it is worth fighting.
Once you have bad breath, you got to guard against it. It'll sneak back.
That way you can smile brighter and breathe easier.
And Dr. Harmon adds that if you need someone to be honest about whether or not you have bad breath, well, you can always trust kids.
You'll get it whether you want it or not.